Hey guys, today we're going to be talking about facelifts, and we had some good questions come in, and these are pretty common questions. So I'll be happy to answer some of them for you. One is kind of a general question: who is a good candidate for a facelift? And when you notice that you have some age-related changes, some laxity, gravity changes, you have jowling, the jawline's not what you wanted anymore, you have kind of a double chin. The age range usually is probably late 30s, early 40s now, on to the 60s and 70s. When I first started 24 years ago, my average facelift patient was in their late 50s. Some patients are awake during a facelift, and our question is, how is that possible? Well, if you use local anesthesia, sometimes we use just local anesthesia, meaning that's just lidocaine, just numbing medicine that's injected here, and you're wide awake. You can do it because it's back here, you don't really see it, it's very well tolerated. I've been doing that for over 20 years now. If you need to, and if you're a little nervous, you can also take a little oral medicine like a Valium, a Xanax, something to kind of calm you down. Is how long the results last. And traditionally we say for facelifting, which is a permanent procedure, the facelift lasts forever, okay? So what the muscles that we resuspend and the skin that we remove, that's not coming back. What happens though is you age from that point on. So if you have a facelift and you're 50 and you look amazing, 10 years later you're still going to look 10 years old. What facelift technique do you recommend? Our favorite technique is the deep plane facelift, which releases all of the tethering ligaments and lifts the muscle up and repositions that where it's more youthful. That doesn't mean we're going to do a deep plane facelift on everyone. How long does the surgery take? So a facelift, if it's just a face and neck lift, typically takes about 2 hours. But if you add a nose, so that's another couple hours, or maybe an hour and a half. If you add the eyes, that's another hour. If you add the brow, that's another half an hour to an hour. So it can go anywhere from 2 to 5 hours. Differences between a mini or a mid facelift and a facelift. So the terminology varies among physicians and providers. For us, we call, when you lift up this area of the face, a facelift. From the jawline to the lower part of the neck, that's a neck lift. So then this and this becomes a face and neck lift. And if you do the eyes and the brows, traditionally that's called a full face and neck lift. A mini lift is if you just need lesser versions of any of those. The bottom line is, whatever you call it, the solution has to fit your problem that you're trying to address. How much downtime is needed after a facelift? So that's actually a great question. The first week you have some bruising and swelling, not much, but enough to warrant you to probably be at home. A week to 10 days later, all the stitches and sutures come out. By 2 weeks, you're starting to feel really good. By 3 weeks, you're really starting to love the way you look. By 4 weeks, you're going to be socially ready to get out there and mingle. What are the risks associated with the deep plane facelift? So you have to know where the nerves are, because the nerves that move your face are at risk. But if you know exactly where the anatomy is, and it's a technically difficult operation, but if you have the experience, then that should never be a problem. There's also potential for scarring, bleeding, infection, but these risks are usually very minimal. What post-operative care is needed after a facelift? So for the first day, you're probably wearing a bandage and you feel a little tight for a whole week. You probably ice the first day or so, and use your ointments, take some antibiotics, take some steroids. We don't want you moving your neck a lot, so we have you move like a robot instead of moving your neck. And then gradually, as the week goes along, after the first or second week, most of your swelling and your bruising is gone, the sutures come out, and you're ready to go.